as you're finishing up high school, and many of you probably have graduated or you're going to graduate, and we know that it looks dramatically different for you, and it looks dramatically different for us in this COVID-19 situation. And we're online as educators developing courses. Point Loma is totally ready. In fact, we're building courses, the three of us are right now, for you. We're not going to be online in the fall, in case that's one of your questions. We're going to be face-to-face. Point Loma is a relational university. That's why we wanted to get face-to-face with you. We miss students, and so we wanted you to hear that now. So I just had that on my brain, and I didn't say it earlier. I told you what my name is. I teach kind of across the undergrad and grad curriculum, predominantly athletic training. We're all three of us are certified athletic trainers, by the way, faculty on here. I'm stepping into a new role, Dean of a College of Health Sciences that we're building. So we'll tell you more about that if you'd like. So Dr. Sawyer?
Yeah, my name is Dr. Brandon Sawyer. I am a professor in kinesiology, and I also am a professor in biology, and I'm the undergrad department chair of kinesiology. And the courses I teach, the course you'd have me in first would be your sophomore year in anatomy and physiology. That's the course I teach in the biology department. And then in the kinesiology department, I teach our exercise physiology course. So so that's where you'll get to interact with me, as well as everything involved with the undergrad side, because I'm over that. So excited to be here with you today.
And let me introduce to you the most important person in our department, Mrs. Amber Courtney. She runs operations for the entire department. And Amber is the one who invited you all here, along with Dr. Sawyer. So Amber, say hi to everybody, and maybe anything you want to tell them.
Yeah, hi everybody, welcome. I hope to see your faces soon. If you have any questions, email me at any time, ambercourtney@pointloma.edu, and I will get you in touch with the correct person. So good to see you guys, nice to meet you.
Thanks for that plug, Amber, to email you. Everybody, you can see all of our emails down here at the bottom, and Amber just gave you her email. By the way, Amber will share with you all of these slides. And so you don't have to take lots of notes if you don't want to. We are not in school, y'all. This is just a casual information session, so you don't have to take notes.
And I am recording, and I'll send the video out to the whole group afterwards.
You guys, we have a student from Rhode Island.
Wow.
And a student from Washington.
All right.
Nice.
Hey,
awesome.
Can you go faster than 55 in Rhode Island now? Last time I was there, the speed limit was 55. You could chat, and you could type that in the chat box if you can. All right.
All right.
Let's go next slide, Dr. Sawyer. Oh my goodness, I stole my own thunder. I was gonna ask you to tell me what kinesiology was. I don't have these slides memorized. Okay, I have to think of another question to ask. But in kinesiology, we study human movement. So kinesis means movement. Ology is just the study of. And so let me give you big perspective, y'all. So movements and human movements can be used both to enhance function and train elite athletes, but it also can be used to prevent disease. Are you hearing what I'm saying? So the entire spectrum, we use human movement both to take people from baseline to high-level performance, Olympic athletes, but we also take people who might be obese or who might have torn their ACL, and we get them from dysfunctional to baseline. So the whole spectrum. And so probably all of you, if you love the human body, you like sciences, particularly biology, maybe physics and chemistry, not so much. That's kind of how we roll. I'm not saying you can't like chemistry, but the human body and science as it relates to the human body is what we do. We're a very applied science, okay? So we study human movement. All right, here's my question. Who thinks they're from the furthest? Maybe it is James from Rhode Island. James, is that you from Rhode Island? Who is chiming in from further away than James from Rhode Island? Anybody? There's something good if somebody wants to beat James. Dr. Cosby, monitor the chat.
I'm on it. James says it seems like everyone drives slow, Dr. Sullivan. So he can't wait to come to California.
Okay.
And it
James,
doesn't look like anyone's beating James in terms of location.
James, congratulations. You're the recipient of an awesome kinesiology shirt being sent to you, you know, in the coming days. Just send a message to Dr. Sawyer, who's the meeting host, with your email address and your address. Everybody else is like, no fair. Okay, next slide, Brandon.
And your shirt size. That might be helpful.
Oh, and your shirt size. Okay, so this is what we want to do, you guys. Well, we welcomed you already. We want to inform you in the next 5 slides of the different majors that kinesiology has, because kinesiology itself is not a major at Point Loma. It's just the department, it's the umbrella. And then really, probably even more importantly, what careers those majors prepare you for. And then we want to answer your questions. So please think about questions and be ready to fire away anything at all for us. That's what we want to dedicate the last few minutes to. Little delay in the slides, huh?
I'm sorry, yeah.
Zoom, no, that's okay. Here's our full-time faculty. So small pictures, I know, but these are all the folks ready to teach you and shape you, live life with you, and really those aren't just words. That's what we do at Point Loma. So if you're ready for that, we're ready to do that with you. Let's dive into some of the majors. And again, you know, I always smile when I see this slide, and we kind of do this jokingly. We don't refer to ourselves as kinesiologists. Some people do, but kinesiology isn't really a career. So let's talk you through our majors and the careers that those majors prepare you for. And I'm going to hand over the reins to Dr. Sawyer.
All right. Yeah, so we really have 2 separate majors in the kinesiology department. The first one that I'll spend some time with is called Applied Health Science. And then the second one that Dr. Cosby will talk a little bit about is now called Health and Human Performance. But probably when you signed up for your major, you probably saw Exercise and Sports Science as the title of the major. So don't worry if you're hearing Health and Human Performance for the first time. Dr. Cosby will explain kind of the two different concentrations within that. But let me start us out with Applied Health Science. So Applied Health Science is truly a pre-graduate school degree, okay? It's not the degree that you want to get and then say, all right, I'm ready for my career job, get me started in that and I'm good to go. That's not what Applied Health Science is. Applied Health Science is a degree that allows you to pick from a large list of electives and tailor your education for the exact prereqs for whatever grad school you're planning on applying to. Okay, so the courses are very clinically focused, but then we also have a heavy emphasis on the sciences and applied health science. Chemistry courses, you'll take general chemistry, take some cell biology, take some OChem, possibly some other courses like that, depending on your career direction. And those are prerequisites for graduate school. So the 2 top graduate schools that our applied health science students go to are number 1, physical therapy school, and then number 2, physician assistant school. You can also be applied health science to be pre-med if you want to go to med school. You can also be applied health science to go to chiropractic school or osteopathic school, a few other routes like that. But those are kind of our big tracks, pre-PT, pre-PA, and then always have a mix of pre-med students. If you're thinking occupational therapy, then Dr. Cosby will talk about a different major for you for that. You don't really need applied health science for that. So just a few of the distinctives, besides the fact that you can really tailor your degree to meet the exact prerequisites for your specific school. A couple of other distinctives are we have a vast network of clinical internships all over the city. And those include physical therapy clinics, hospitals, working in private practice clinics with PAs or with nurses or with physicians. And the nice part about those courses is it counts as an upper division elective, and each of those are taught by the specific person who already does that job. So for example, the one for the people who are, for the pre-PT people, is taught by a licensed physical therapist, Dr. Paul Hodge, who spends most of his time in the clinic as a full-time physical therapist, but he spends one morning a week with us, walking all of our students through the basics of hands-on assessment, taking a history, and then setting you up with your clinical internship sites. The one on the PA side is taught by a licensed physician assistant. Again, walking you through those basic skills, doing some case studies, and then setting you up with an internship. So you can take that course at least once, and you're guaranteed an internship if you take that course. We also have some very hands-on courses that are teach you how to assess injuries, upper extremity injury assessment, lower extremity injuries assessment, therapeutic exercise. And then we have a couple of our distinctives include our laboratories. We have a gross anatomy lab that Dr. Crosby is in charge of, and it's a pretty unique thing on the undergraduate side to be able to do full cadaver dissection as an undergrad. But in our gross anatomy lab, we have 4 full cadavers as well as multiple limbs. I know that's hopefully you're not eating anything right now, but it's not necessarily what everyone's comfortable hearing, but it's really the best way to learn anatomy. And Dr. Crosby does an incredible job running that lab, as well as some of our other faculty that teach that lab. And so you get hands-on experience, big time learning anatomy. We have a state-of-the-art biomechanics lab, state-of-the-art exercise physiology lab, state-of-the-art sports science lab. So all of those laboratories give you vast opportunities to get those hands-on experiences. Yeah, and so this is kind of what I already said, except for the one path that I didn't mention. If you're interested in academics, if you want to go on and get your master's and your PhD in a specialized field, that could be biomechanics, exercise physiology, sports science, something like that, then applied health science could be a good route for you as well. So that's really the basics of the applied health science degree. So I'm going to hand it over to Dr. Crosby to talk to us about health and human performance. Oh, you're muted.
Yeah, hi,
there you go.
Dr. Sawyer.
Yes.
I get the privilege of talking about our health and human performance major, or as I'm assuming most of you probably have, like right now on your application, the exercise and sports science major. They are the same, so please do not stress out. Once you get here, we'll fix everything and get the name changed accordingly. But what I want to really focus on here are the 2 concentrations within this major, because a lot of times what we see is that students are in the wrong major. So we want to make sure that you're ahead of the game, that you really truly are in the correct major and within the correct concentration to get you where you need to go for graduate school or for healthcare professions. So there are 2 concentrations. The first concentration is the exercise and sports science concentration. And then the second concentration is going to be the pre-allied healthcare track. And so I kind of want to walk you through what each of those concentrations prepares you for. If you're thinking pre-allied health, I mean, that's my baby. That's like at the heart of what I wake up to do. So we're thinking pre-allied health. The name, as it implies, is going to prepare you to go into some field of healthcare, right? Pre meaning we're preparing you for graduate school, or we're preparing you for the next step, kind of like the applied health science major, but a little bit different. If you choose this concentration, there are less science class requirements, so that it's less rigorous on the science side and the lab side of the house. So this is the major to choose, or the concentration to choose, if you are planning to go into the following vocations. If you're planning on being an occupational therapist, if you want to, maybe you're a transfer student and you couldn't get into our nursing program, but you still have these aspirations of being a nurse, then you would choose this concentration. And last but certainly not least, if you are thinking about athletic training, this would be the concentration that was actually designed for athletic training, pre-athletic training students. With that said, I know some of you had the opportunity to ask us questions prior to coming to the session. One of the questions was, can I be an applied health science major and still go through the 3+2 track for athletic training? The answer is absolutely yes. We currently have 2 students who went through the applied health science concentration and are now in our Masters of Science in Athletic Training. Is it a little bit more rigorous? Is it a little bit more time consuming to be an applied health science major and do athletic training? Certainly, but it is absolutely possible to be an applied health science major. With that said, pre-athletic training, this concentration is truly for you, unless you want to be what we call a dual credentialed individual. So maybe you want to be a physician's assistant and a certified athletic trainer, or a physical therapist and a certified athletic trainer. If that is you, if you want to be dual credentialed, choose the applied health science major. If you, I'm not going to say this just part, I don't like saying just, but if you just want to be an athletic trainer and that's what you're built to do, you were born, you know that's what you want to do, then this is the correct career path for you, pre-allied health concentration. Moving forward, Dr. Sawyer, I think.
Yep.
Okay, so go back, Dr. Sawyer, one.
We'll go back.
So
Sorry.
let's talk about the exercise science concentration very briefly. If you were thinking about going into what Dr. Gooden would call is sports science, so you want to be a sports scientist. What does that mean? That means you want to be a strength and conditioning coach. That means maybe you want to be a physical educator. Dr. Sawyer, Dr. Sullivan, am I missing anything in terms of exercise science? What else?
Strength and conditioning coach.
That.
So the new and emerging language that you might have heard is sports scientist. So you want to do you want to be involved with a high level organization, and you want to come at it from strength and conditioning and nutrition and mental health and behavioral health. That's sports science.
Perfect. So if you have questions, and if it's not clear which concentration you should choose, ask it in the chat. And at the end of this, what we'll do is go back and answer any questions that you might have. You can skip to the next slide, which is the athletic training program. I think a lot of students are always asking, well, how do I do this? How do I do this? Can I transfer in and get into the athletic training program? Do I have to be a first-time freshman to get into the athletic training program? And the answer is E, all of the above. You could be a first-time freshman. You could be a transfer. Doesn't really matter when you come to us. What matters with the athletic training program is that you have all of the classes necessary to apply to the actual program itself. So very briefly, we've created a program that will allow you to get either a Bachelor's of Science in Applied Health Science or a Bachelor's of Art in Health and Human Performance in 4 years. And then you would finish your 5th year with a Master's of Science in Athletic Training. So this is a rigorous degree. You leave us in 5 years with 2 degrees, an undergraduate degree and a graduate degree. So is it an easy path? Absolutely not. But is it worth it? Yes, because at the end of that 5 years, you will be a certified athletic trainer. You'll be able to practice in the field of athletic training. If your goal is to work with college athletes, then you'll be able to do that as well. So regardless of if you're a transfer student or a first-time freshman, we have paths designed for each of those students. The question that I always get asked is, what are my opportunities if I'm an athletic trainer? So most often, I'd say about 60% of our students currently are working in the high school setting. About 20% of those students are also teaching and being an athletic trainer in the high school setting. And then you certainly could work at the college level. I think it's more possible now that we have the MS in AT to start off at the college level. And then you could work junior college, professional sports, which is very small % chance likelihood, but certainly we've had students graduate from our program and work with professionals. And where we're starting to see the industry kind of blow up is quite honestly in the realm of corporate. So in other words, you're working with Amazon, Disneyland, PayPal. Am I missing any good ones? Those are the 3 that we can think of that our students are currently working with. So that is the health and human performance major. Those are its concentrations, and that's how you would get into the athletic training program.
Great. Yeah, well, we'd love to field any questions that you all have for us right now. So what do you got? What's on your mind? Either put it in the chat or go ahead and unmute yourself and let us know what you're thinking.
And just to piggyback off the 3 who shared their career direction, if you said physical therapy, that would be applied health science. If you said, one of you said prosthetics and you want to be an orthotist, correct me if I'm wrong, Dr. Cosby, but you could go multiple ways, but I think health and human performance, and then choose one of the concentrations. And we've, as I said in the chat, we have just a phenomenal biomechanist who will train you to use skills to analyze movement and then connect you. And the San Diego region is good with the military with prosthetics. And then the other person shared either PA or PT, I think. Oh, and we had an AT. So AT, that path is clear. Yeah. The either PA or PT, both of those are applied health science.
And then P just asked the question about, are there a lot of opportunities for exploration of different career paths within the 4 years? I would say P, if you don't change either your major or what you want to do at least twice while you're here, that's typically normal. The average, I don't know, what do you guys see? Like, we have students flip-flopping between our majors within our department. So it's completely normal. What I would always say is, if you're kind of wavering between, let's say, AT and PT, because that typically is where we see kind of like, which one should I do? We always say err on the side of the applied health science route, because it's the one that has the more rigorous requirements. You can always drop down into the health and human performance major. It's a lot harder to start as a health and human performance major and go to the applied health science route. What do you guys think, Dr. Sullivan, Dr. Sawyer?
Yeah, I think that's good advice to if you're thinking maybe athletic training or nursing or OT, but you think maybe I want to be a PT or maybe I want to be a PA, then start with applied health science, because you're not setting yourself back there. The biggest thing that really happens your freshman year is you start with general chemistry as an applied health science major. If you start with the other major, you won't get that general chemistry, and that'll just kind of that'll slow down your track a little bit. So it's best just to start with applied health science. If there's any inkling of maybe I want to be a physical therapist, maybe I want to be a physician assistant, or maybe I want to go to med school, because you're going to need that general chemistry first, and then you can go to the exercise and sports science degree later if you'd like, and that chemistry still counts as the chemistry that you need for the major.
Yeah, I'll take Madeline's question, because I think you want to go AT. Correct me if I'm wrong in the chat, Madeline. So is there an opportunity for you to work with athletes? Oh yes, you'll get about 1,100 to 1,400 hours of working with nothing but athletic people. So you'll get high school opportunities, you'll get college opportunities, and then some non-orthopedic kind of opportunities as well. So the answer would be yes, if you're athletic training, which I think you are. Dr. Sullivan, Kenneth is asking about major changes. He's currently pre-PT, but he's in the exercise and sports science major. Can you assist him with that?
Sure. Yeah, Kenneth, I saw that as you were typing it. I would tell everybody on the call, don't worry, you have plenty of time. It's very easy to change your major through our records office. And what we're doing for you right now is what we're going to do for about 100 other students when you go to new student orientation in August. And at that point, we catch everybody and we do lots of changing. But anytime between now and then, you could contact our records office. Yeah, and in your case, you want to be a PT for a major league sport team, so that's applied health science. If you said you wanted to be a dual, like what Dr. Cosby said, you wanted to be dual athletic trainer and physical therapist, then we could navigate you through that. You know, and as she said, you know, you may want to do, you definitely want to do the prereqs for PT school, which are in the applied health science major, but then you also want to do that 3+2. MS in athletic training. So you don't have to memorize all that now. What I want everybody to hear me say is you have plenty of time and it's easy to change your major. And as you kind of probably have seen, the three of us and all the other faculty are readily available to you as advisors to help you through that.
So there's a question that I think all of us could answer differently. So maybe we could all answer this one. It's how can our students prepare over the summer for entering into the Department of Kinesiology in their first year as a freshman? Who wants to take that first?
I'll go last because I think I have something to say that you two won't.
Okay.
Yeah, I can go for it. Yeah, I'll keep going down the chemistry train because if there's one class that our students struggle with more than any others, it's that general chemistry course as a applied health science student, or the chemistry that you take in the spring as an exercise and sports science or health and human performance student. So if you have a little time and you want to brush up on your chemistry a little bit from high school, that would be the one academic thing I would recommend doing to get ready for the fall. So I'll leave mine with an academic suggestion. I bet some of the others have a different suggestions. So go ahead.
I'll say this is kinesiology. The foundation for learning kinesiology or studying is anatomy. It's the baseline. So probably just brushing up on your basic anatomy will help you be successful in your first year. But I'm a mom too, so I'm going to give you some mom advice, which is enjoy your family while you're there. Get quality time because when you get here, I mean, the 4 years go by so quick. So if it were me and you, if you were my kid and you were leaving me, I'd want to spend as much time. We're all quarantined, so we're probably already doing that. But get quality time with your friends, with your family, because when you get here, you get immersed in this place, and it's a whole different experience, a great experience, but certainly a different world than where you are currently.
Dr. Cosby stole my mom advice. I was going to give dad advice. So I'm the dad of a high school junior who wants to get all 4s and 5s, but mostly 5s she wants on her AP exams. And so I'm here to tell you, I want to deconstruct your ideas. It doesn't mean you don't work hard in college. We have students who have 4.0s, but it doesn't mean too much in college. Those GPAs, and I know you're like, what in the heck? You've worked for 12 years to get into college, particularly Point Loma. Now I need you to figure out who you want to be and why you want to be that person. Not about grades, because when you go for your first job interview, nobody's going to ask you what your GPA is in college. If they do, text me, but I haven't had that question in an interview yet. And I know that that goes against what your high school teachers tell you, but college, start thinking about your why. Like, what is your why? And in other words, who do you want to be? Why do you want to do something to make money? But really it's about who you're becoming. So take personality inventories like Myers-Briggs, pray and ask God who he's created you to be, and then start to align those passions with a career, and you'll be happy. I know you've heard this, but it's true. The three of us, I think you probably can tell, wake up to teach and to inspire young people to go and come alive in the movement professions. So stop trying to get A's. I don't mean you shouldn't get A's, but stop having that be your whole focus. Am I preaching at you? Yes. This is what I say to my daughter. It's about who you're becoming, not about your GPA. And so we'll wake you up to all of that when you get to Point Loma, but I hope you can hear the excitement in our voices. We're ready to welcome you to that. But some of you are going to stress out about, gosh, do I do PA or PT or AT? We're going to ask you deeper questions that will inform then what you do for a career.
Awesome. Thank you, Dr. Sullivan. Looks like James has a question. Go ahead, James. You can ask it verbally.
Yeah. So I watched the College of Natural Sciences Zoom meeting that was recorded a few weeks ago. I had a question. It kind of sparked a question in my mind. I emailed Dr. Sullivan about it. So I thought about double majoring with Spanish as well, but I'm thinking just a minor is all that I'm looking for at this point. And I recognize that the health science program is very rigorous and needs a lot of attention in that. And before I reached out to the records office, I just want to pick your guys' brains to see. I want to, of course, prepare well for graduate school and have all the internships and hours that are involved with that. I also want to go abroad a semester if that's possible. I just wanted to know, the Spanish minor would be like the third thing on my list of importance. I'm wondering if you guys think that's worth it. And it's something I would love to do if it's feasible and I'm not going to be like compromising my undergraduate experience.
I'll take a stab at it. And I did get your email, James. I'm sorry. This is a public apology. James sent me an email like 2 days ago and I haven't responded. But the first thing that comes to my mind, James, is I had an advisee graduate 2 years ago. She was applied health science and a Spanish major. And she went to PT school. So, yeah, I mean, yes, be a Spanish major or minor, because if you want to go into healthcare, then of course being bilingual gives you it's a powerful tool for your patients, right? So you can communicate to them. My opinion would be that a minor would be just as weighty as a major in terms of like it helping you in your future profession. Really, the idea is you want to communicate with your patients. And so I don't know technically the difference in units between minor and major, but you could look that up on Point Loma's catalog. Go into our and I can help you. I'll look it up for you too.
I've done that, and I think the major difference, or I should say the difference between the units and the minor to the major is a lot more cultural classes rather than just lingual. And what I'm looking for is a mastery of language more than anything.
Yeah.
I think you have your answer there then. I think a minor would serve you just fine. And Dr. Sawyer, you want to address the study abroad for everybody?
Yeah, for sure. Yeah, and I'll just say too, I've had multiple advisees who have done either a French double major or Spanish, and then the minor as well. I've had quite a few Spanish minor students in applied health science, and it's definitely doable. I will say that it helps if you come in with like an AP Spanish that counts for 1 semester or 2 semesters, and if you already have some Spanish, you can take the Spanish SAT-2 exam when you get here, and you may be able to test out of 1 or 2 Spanishes. So that'd be something to look into, James, when you first get on campus, is seeing if you can test out of it if you've already got some prior experience in Spanish. Yeah, and then the study abroad option for sure. We've been doing some work on trying to make it even more accessible and easy for students to study abroad in kinesiology. And really, I'll say that junior year is the best year to study abroad, because it's when you're done with your year-long sequence courses. And we've got some great options in Africa and Australia. Those are 2 where you can actually get some upper division major courses completed. And then there's lots of students that go to Europe and South America. And then in most cases, Europe and South America, we're mostly thinking GE courses there. But a couple places in Europe, like Spain, we've had some students that have been able to take some upper division major courses. But it's definitely doable to study abroad as an applied health science or exercise and sports science major. And junior year is probably the best. But I've also had students that have done it sophomore year, and we're able to work with that too. So you got lots of options there. Yeah. Any other questions coming up?
Not that I can see.
Okay, well, maybe while people are thinking, I'll just tell one quick story, and one thing that I think just kind of highlights what we're all about in the kinesiology department in Point Loma. So actually, all 3 of us faculty on the Zoom call right now are alumni from Point Loma, and we all graduated from the kinesiology department as undergraduates, and all of us had our lives changed by mentors in the department, by faculty who cared enough about us to pray with us, to ask us those questions that made us kind of share what was going on in our lives, and just kind of as an example, that's just what we do on a daily basis with our students, and so you come to a place like Point Loma because you want something more than just the typical, I'm going to get my degree, I'm going to do my academics, I'm going to move on. You're going to get a lot more than that if you want it at Point Loma. You have the opportunity to be mentored, to be kind of walked alongside, and we really want to help you grow as a whole person in Christ. And that's really what we're all about. We could all be at different places, at bigger schools, doing different things, but we believe in what Point Loma is all about, and that's growing you as a whole person. And so that's what we get to do on a daily basis. That's what people did for us. And so we were changed so much by it, but all 3 of us said, we want to come back and do that for people because it changed our lives. And so, yeah, I hope that gets you a little bit excited, because it definitely gets me excited.
Good question. Awesome, Dr. Sawyer. I love it. P has a good question. Dr. Cosby, you want to take it?
Oh, well, that's what I was going to punt that one to the dean.
Oh, okay. Yeah. So P is asking, good. So if you all haven't read the email that came out from the president, Dr. Brower, we refer to him as Bobby B around here. He talked about, oh shoot, Dr. Cosby, you have to tell me the exact day, a 2-week earlier start date, which is August
17th.
17th.
Yeah.
And so P's question is, will this term, the mini term, quote unquote, have the same class offerings as a normal semester? Yes, absolutely. So kinesiology didn't delete, are you talking about January, Feb, or are you talking about August to Thanksgiving?
I was thinking she was talking about January,
The January, Feb, yeah.
Oh, I'm sorry, P. So the fall is going to be totally the same. That January, Feb, we're thinking of it as like a summer term. And so we could name, are you thinking about, will the same kinesiology classes being offered or the same across the entire university? So let me speak about kinesiology and you can type in the chat. We offer an abbreviated list. So you probably won't be able to get 100% of your upper division courses, although you guys won't care about that anyway. You'll be freshmen. But the basic courses in kinesiology, like our general education offerings, like optimal health, and we have a new awesome class called lifestyle medicine. Those are online. And so, yes, those are going to be offered. So those critical classes, and care and prevention of athletic injuries, which is a prereq class for the MSAT, athletic training program, those will be offered. So we're going to offer those classes that you need either in your freshman or sophomore year. So you won't, how about to say it this way, a double negative, you won't not get the classes, so you will get the classes that you need in that January, February term. But we're not going to offer every class that we typically would offer in the fall or spring.
Yeah, and I would say that we would offer courses that would be suitable to a 5-week term. Some of our courses are so intense with content that it wouldn't be advantageous for the student to take that content over a 5-week condensed kind of schedule.
We're doing sorry, go ahead, Dr. Sawyer.
No, I was just going to say on the general education side, I'm sure that we'll have a lot of GE courses offered during that term, similar to what we have in the summer, which is almost all of our general education courses, at least the lower division ones, and then even some upper division ones. So there'll be plenty of courses offered that you could take. You could definitely take 2 or 3 courses if you wanted to, probably 2 during that term. And those could be 2 GE courses or maybe a GE and a major course, depending on what you want to do. Yeah. What else? Any other questions for us?
If I were entertaining the thought of applying to med school, would that look any different for me in terms of my undergraduate experience, specifically for the first, say, 1 or 2 years?
Yeah,
as opposed to like PT or PA, which I mentioned previously.
Yeah, it looks a little bit different, not too much different really than the pre-PA track for those first couple of years. You're going to take the general chemistry first year, and then you would take OChem, the full year of OChem, your second year. And so that's where you would kind of differ from the pre-PA track. And for the pre-PA track, you would just take 1 semester of OChem. For pre-med, you'd most likely, you need both. You would need to take calculus for med school, which some of our pre-PA students take that as well. And a lot of times that happens in the first couple of years. The other one you would take, all of our applied health science students take cell biology, which is Bio 2010. But then for med school, you have to take the other one that kind of goes along with that, which is evolutionary biology, the Bio 2011. So there's a couple extra courses in there that you would take during those first 2 years. And then either way, whether you're pre-PA or pre-med, we would connect you with our pre-health advisor, Dr. Sarah Chung, and they have a lot of pre-health events that happen. And there is actually a class you can take that's kind of geared towards getting you ready to apply to med school or dental school. And you could take that as an elective if you wanted to. That's a chemistry course. I think it's Chem 201 or 2001 or something. So yeah, there's a few extra courses you would take if you wanted to go pre-med. But all of those courses count as electives in the applied health science major too. So whether you just decide to stick with applied health science or you want to go biology or chemistry, either way would work for pre-med.
Good, thank you.
Yeah, for sure.
When you come, we've got all the pre-med requirements, and they've been updated as medical schools have wanted doctors to go deeper into sociology and psychology in these last standards. So we're on top of that, and we'll float that to you. So like Dr. Sawyer just said, if any of you want to practice medicine, I mean, you could choose MD, DO, which is osteopathy, or physician assistant, right? All of those folks practice medicine. And either you choose applied health science with us, or you choose biology chemistry major with biology and chemistry departments. Either way, we have lots of overlap. We'll inherit like 10 or 12 of their students every year, or some of our students leave, not as many, leave us to go to them. But yeah, we're totally fluid with that.
Yeah. All right. Well, any other last questions everyone wants to ask or throw in the chat? Okay, well, you have all of our contact info in these slides, and it's always just the full name of the faculty member, and at pointloma.edu. If you want to email any of us, you can do that. I will send out this recording to the same group I send out to the invite to, so you can take a look and let us know if you have questions. If you're trying to decide, you're not sure what you want to do, or we're more than happy to talk with you. We can set up a time to Zoom one-on-one. I've done that with multiple prospective students already in the past couple months. So happy to do that. Happy to help you figure out what you want to do. So it was a pleasure being with you all today. And yeah, we hope you the best, wish the best summer, and hope to see you in the fall.
Bye, everybody. Nice to see you. And if anybody wants to stay on, we're happy to stay on a few minutes and chat to you. But happy summer, everybody. Great to meet you.
Bye-bye. You're welcome.